would like now to introduce Pierre-Henri Beckmer and Jimmy Chamas, resident and fellow in the department, who will show you some of our experimental data.
Thank you, Professor Bossier. So we started our experimentation with the pterygium surgery. As you can see here, a pterygium is a wing-shaped fibrovascular conjunctival overgrowth extending over the cornea. So it has to be removed when that vision decreases or when there is a significant cosmetic blemish. Here is our kit for ocular surface surgery model. Since there is no surgical simulator and no training model, we developed our own homemade model using glue, as you can see here, and cold cuts. A pig eye, pig, that is Swiss beef, and duck. The pig eye is in the center, just here. Mortadella slices represent the tendon capsules, and a small piece of duck meat, just here, represents the pterygium tissue. And the large piece of Swiss beef is here, it's the conjunctiva. The first step of the surgery, of pterygium surgery, is dissection of the head, just here, using synaptic scalpel. After the second step is excision of the body using hot scissors. Then we prepared a piece of beef, just here, corresponding to a conjunctival graft. The graft is then suture reattached to the edge of the area, the excision area, using 8/0 polyguide stitches. So we also developed used cold cuts to develop our strabismus model. So it contained nearly the same elements as before, as the pterygium model, but we needed a lot more duck meat to recreate the ocular muscle. Just, you can see here. So the strabismus surgery, first we opened the conjunctiva, as you can see here. Then we attach the extraocular muscle with 5/0 polygactine thread. The muscle, just here. The muscle is then cut off, and we reattach it more anteriorly to the sclera. Then we close the conjunctiva. Then we moved on amniotic membrane transplantation. Amniotic membrane transplantation is a surgical technique that should be considered for ocular burns, infection, or neurotrophic keratitis. You can see here the graft technique. An 8 mm amniotic membrane monolayer is sutured to the cornea with 10/0 nylon. Here you can see the 6 stitches. You can see now the patch technique. A 12 mm amniotic membrane monolayer is placed over the entire cornea and then sutured with 8 stitches of 8/0 polygactine to the conjunctiva. I leave you the rest. Thank you very much.
Thank you, Professor Boursier. Thank you, Pierre-Henri. Now you can see the patch technique, a 12 mm amniotic membrane layer. We also perform penetrating keratoplasties on pig eyes. We used an 8 mm trephine to cut the cornea. The bottom was then reattached using 10/0 nylon. We used black diamond microforceps to do the 3 suture loops, and a total of 16 stitches were done on each cornea. We also perform keratoplasties with the XI version. Visualization of the operative field is better than with the SI version. Therefore, the average operative time decreased from 60 to 45 minutes. Here you can see the pig corneas, which is much thicker than the human one. More recently, we performed penetrative keratoplasties with human corneas from the eye bank. Human corneas are thinner than porcine corneas, recreating real-life surgical conditions. Corneas were placed on an artificial anterior chamber, and after 7 mm trephination, the button was reattached, again with a 10-0 nylon running suture, and the duration of the procedure decreased now to 30 minutes, which is half of what was in the beginning. Post-operative corneal OCT showed the accurate placement of the sutures.